Thanks everyone for joining us. Let me say that again. Thank you, Becky. Thanks everyone for joining us. Got a little bit of housekeeping up front, and then I'm going to turn it over to Elizabeth Stauber and Dr. Lori Dong to do their presentation. As part of that housekeeping, Becky is going to be sharing a poll question that we'd love you all to participate in. It will help inform some of the decision making going forward on how we coordinate and what we coordinate for these sessions. You should be seeing that in your screen now. While you take that, I'll just take a moment to thank our corporate partners you see listed on the screen before you, Preservica Ancestry, AppX, Family Search, as well as Atlas from the page and SMA. Thank them for their contributions that allow us to provide this type of programming. Today's agenda is going to include the presentation, obviously, and we will have plenty of time at the end for discussion. So save your questions. Be thinking about what you might want to ask your peers here. And then Becky will give us a little bit of update at the very end on some of the programming you can anticipate and look forward to, and how you might get involved with CoSA. Thanks again to everyone for attending. You're going to be hearing a presentation on the Hogg Foundation's Dialogues on Mental Health Records. The Hogg Foundation is a forum to discuss the management, preservation, and sharing of historical public mental health records. To date, they have conducted a landscape analysis of state, school, and hospital preservation. They held 5 virtual meetings with approximately 100 stakeholders in the management of historical mental health records and established a monthly presentation series for others to share their work. If you're not aware of this, the most recent one of these monthly sessions took place earlier this week. I highly encourage you all to look for those. These efforts are leading to an in-person symposium in Austin, Texas on September 24th through 25th later this year. Participants include archivists, historians, genealogists, hospital administrators and staff, and mental health consumers, many of whom identified themselves as belonging to multiple stakeholder groups. The conversation will follow the presentation, where participants are invited to discuss and learn from each other's shared experience working with mental health records, discover the similarities and differences across our collections, and how some of your peers are navigating these issues. Thank you again to Elizabeth and Dr. Lori Dong for their willingness to join us and present on this topic. I'm going to turn it over to them now.
Great, thanks, y'all. I will share my screen, so bear with me. All right, there we go. Okay, well, thank you all so much for having us here today. I am Elizabeth Stauber with the Hogg Foundation for Mental Health in Texas. I am the project director for the Dialogues on Mental Health Records project, which is a platform, as Rusty said, to address the challenges of managing historical public mental health records through a series of virtual meetings that started last summer, and it's culminating in the in-person symposium in September of this year. So these forums have brought together people across the country, across disciplines and life experiences, including historians, genealogists, descendants, archivists, psychiatrists, hospital administrators, and former patients.
And hi, everyone. I'm Lori Dong, and I'm a preservation and archives consultant. I live in Washington State, in Snohomish, Washington. I completed my information studies master's and doctorate at the University of Texas at Austin. My dissertation and postdoc work were focused on the historical mental health records at Central State Hospital in Petersburg, Virginia. I worked closely with Dr. King Davis for many years, who was the PI for the Central State Project and is also a former executive director of the Hogg Foundation. So for the project that we're talking about today, I have sense-making role, and I've been helping to distill our findings and figure out next steps.
Yeah, so just some background. The Hogg Foundation has an organizational archive, that documents our long history in the mental health space in Texas. We've been around since 1940. And the records at the Hogg Foundation are particularly important to the history of mental health and illness in Texas because they are not medical records, they are grant records. And so we can easily share these records with the public without fear of releasing personal health information. But today, I'm not talking about the Hogg Foundation's records. I'm going to talk about state hospital records, which are much more complex. So over the last 7 years, I've worked with the Austin State Hospital and the Texas State Hospital system at large, advising on how to develop a preservation program for their history. And in the course of that work, I had the opportunity to speak with others who were engaged in similar projects in other states. And I learned that this work is frequently done in silos. It's done state by state and oftentimes hospital by hospital. And so in these conversations, I really wanted to find a way that we could potentially all work together and through some of the more complex challenges of this work. So that's what got my gears turning. And so I applied for a grant from the Institute of Museum and Library Services in 2023 to fund this project, and Joy very graciously contributed a letter of support at that time. And so in July of 2024, I was notified that we got the grant, which was very exciting. But there have been a lot of ups and downs with this project, as the grant was then canceled in April of 2025 and then reinstated in November of 2025. And so it was a little rocky as to where the funding was going to come from. But fortunately, in the 7 months that it was canceled, the Hogg Foundation filled in the funding gaps, which allowed the project to continue without too much of a significant pause. We were very fortunate. I'm very fortunate to work at an organization that's able to do stuff like that. So I won't go too deep into this because I know my audience, but many state hospitals in the United States were established in the late 1800s, and they were often really deeply connected to the local communities, much more so than they are today. People would live, work, and play on the grounds, whether they were a patient or not. You will often find photographs or illustrations of people picnicking on these beautiful grounds. And so there was much more integration with the community at that time. State hospitals were also at the center of many historical movements, including segregation and desegregation, deinstitutionalization, lots of major medical breakthroughs, and a social movement of people with lived experience with mental illness fighting for their rights. So this complex social, medical, and political history is often flattened into ghost stories of haunted asylums. And it is my belief that sharing this history in a manner that is respectful to the patients, to the workers, and the families can help counter that stigma against people who receive care in psychiatric hospitals. So this project very specifically addresses historical public mental health records, which include administrative records, photographs, artifacts, and of course, patient records with identifiable health information about individuals 50 years following their death. So we're not talking about active medical records, but rather records that fall in that time frame that was carved out by the U.S. Department of Health and Human Services for the purpose of historical preservation. These older records are crucial for our collective understanding of the historical impact of these public institutions on social movements, mental health care, and family history. There are many challenges with accessing these records, as well as challenges to preserving them, which many of y'all are probably very familiar with. So the goals, this project is really about bringing experts across disciplines and experiences together to discuss the challenges of preserving historical public mental health records. So the goals are to create a platform to address the challenges by bringing together stakeholders at multiple nationwide virtual meetings and one in-person meeting, to capture the discussion and present it widely, which is where Lori comes in, and to create a community of practice that will continue working together after the meetings have concluded. So the first thing that we did was conduct a landscape analysis to understand the status of state hospital preservation work nationwide. Who is out there trying to save this history and how are they doing it? Graduate research assistant Cash Kelly spent the academic year of fall 2024 and spring 2025 gathering data on 372 historic state-operated mental health facilities and nearly 500 state hospital preservation projects. They then compiled this information into a report titled State School and Hospital Preservation, a Survey of the Field. So you can read this report on the Hogg Foundation's website. And I was going to share it in the chat, but I need to find the chat. Here we go. So there's a link to it. This report identifies 6 types of preservation projects: architecture, cemeteries, histories, museums, records, and policy. And this project type categories, they're meant to capture the preservation priorities of each program, because oftentimes you'll find that there's overlap between what's included in a project. It's not necessarily just focused on the architecture, but it might include elements of history and records as well. But the priority would be architecture. And then the project types also help us track the wide variety of work being done on state hospital preservation, because again, it's not just museums, or it's not just history books. There's a lot of different ways that people come at this history. So the landscape analysis was really great because it helped us get a handle on what was happening, but it also served as a really valuable outreach tool. And so during that first year of the project, it was essentially me and Cash just introducing ourselves to people and getting to know who's out there and saying hello. And it allowed us to figure out who to start inviting to these initial meetings. So in order to organize the meetings, I identified 4 broad stakeholder experts of historical public mental health records groups. The first being archivists, librarians, preservation professionals, pretty much everyone that we covered, that we found through the landscape analysis. The second group is hospital administrators, psychiatrists, peer support workers, and anyone who is associated professionally with the hospital industry, someone who works for the hospital. Third is researchers, historians, genealogists, family members, descendants, and people who want to use and access these records for research. And then the fourth is former patients to provide perspectives on how they would like to see these records handled and shared, as they are often the subjects of the records. And of course, we can't go back in time and ask people 100 years ago what they think, but we can ask the contemporary folks. So the inclusion of people across the country, across disciplines and life experiences, is one of the most important aspects of this project. On the surface, the topic appears to be very niche. How many people are out there talking about historical public mental health records? It's a big mouthful. It feels very specific. But upon closer examination, you find that these records impact an incredible range of people. And often it is the stigma associated with these institutions that quietens our collective understanding. People don't really want to talk about it. But you would be surprised at the many stories of disclosure I have heard from folks when I tell them about the work I do. Oh, I had a great grandfather who was a patient at a hospital. I found that out through the census. That's a very common response. So another important reason to include this diverse set of people is that a lot of the breakdown that happens in gaining access is caused by communication issues and assumptions from one group on another. There are a lot of technical terms in the field of archiving. You know, when I tell people I'm an archivist, they're like people have a very specific idea of what that means. That is not the idea that I share with them. So it can be hard for people to understand what I'm trying to do, just because they don't speak the language of archives. There's also a lot of very specific technical terms in the mental health care industry that are, you know, not immediately understood by archivists or records managers. Um, Historians and genealogy have really different and varied philosophies on what it means to interact with history. And then, of course, former patients can be anybody, and they can come from all sorts of backgrounds. So it takes a minute to understand each other. So that's one of the reasons why we really wanted to bring everyone start building that foundation. So when we did the landscape analysis, we started introducing ourselves to folks. Now we are bringing people together, and in these virtual meetings where the stakeholders can share their challenges, concerns, needs, solutions, and potential uses of these records. So several of these meetings took place as Zoom meetings over the summer and in fall of 2025. We hosted 2 meetings for archivists, 2 meetings for researchers, and 1 meeting for hospital administrators. We had varying levels of participation for each meeting, with the hospital administrator meeting being the least attended. It had a significant amount of drop off, which was really interesting. Um, we had a similar amount of people register for all of the meetings, but the hospital administrator one had the most amount of drop off, which is just, you know, I guess culturally very interesting. We attempted to host one for former patients, but we didn't get very many registrations to actually hold it. So we've been, is not super surprising. It's a lot to ask of someone to enter into a virtual space to talk about a time that you were in crisis with a bunch of strangers. But we wanted to kind of give folks a opportunity at least to engage in a similar manner. So for former patients right now, I'm working on engagement at the local in-person level so that we can really take time to get to know folks and build trust. And I'll speak a little bit more on that later. But participants in the virtual meetings discussed their own experiences managing, preserving, and using historical public mental health records. And discussion questions in the first round of meetings included variations on what are the challenges people face when it comes to these records, and how can we protect patient privacy while also sharing a hospital's impact and history. So I will pass it over to Lori.
Thanks, Elizabeth. Yeah, so from these fruitful discussions that we had with all these different stakeholder groups, we identified the challenges that kept coming up across all these different groups. And we were able to sort them into 4 major categories: legal, ethics, access, and preservation. And one participant actually noticed, oh, it's LEAP. What a perfect, way to remember it. So the legal challenges include how different states approach patient privacy. So, we know HIPAA specifically protects individually identifiable health information for 50 years, following the date of death of the individual. But some states follow HIPAA, while others have adopted far more restrictive state laws with their medical records. Some only allow public access after 75 years, 125 years, or never. They are protected in perpetuity. So, furthermore, while many records produced by state hospitals do not include individually identifiable health information, they are often still restricted because it can be difficult to determine which records have protected information and which do not, especially with these historical records that do not look like our health records today. The ethical challenges reflect the many perspectives and sometimes conflicting opinions, even within stakeholder groups. And they include a lot of interesting questions, such as who should determine what happens to historical health records and the information that they contain when stakeholders disagree? Another question is anonymized data enough for research purposes, or is it important for researchers to have access to personal information to humanize those who've been institutionalized? And another question is HIPAA and its protection of patient privacy enough to protect those affected by historical health records? Or is the notion of protecting patients and their families' dignity, and this word dignity kept on coming up in our conversation, is it more important to protect patients and their families' dignity? Is that a better touchstone to ensure ethical research? Access challenges included, for one, a lack of staffing and protocols to allow timely access to records, especially in covered entities like hospitals. Another challenge for access includes the labor-intensive and costly procedures for access that are not feasible for family members to undertake. And also, lastly, it's the difficulty in establishing long-term relationships between record holders and the record seekers. Preservation challenges included, improper environmental conditions, especially in those older or unused buildings. Like in my own project, there were a lot of abandoned buildings on the hospital campus. There's also a lack of training and resources for long-term records care. And this includes a difficulty to physically locate records and to describe them. And the information in these records are highly valuable, but only if you know where they are and what they contain. And without proper management, their value can actually become a burden. So in the second round of meetings, we brought these results back to our participants, and based on the 4 identified challenge areas, or LEAP, we polled the archivist group and the researcher group, and we asked them, if you have been or are currently involved in a project or program involving historical hospital records, what has been the primary challenge area? And interestingly, both groups had very similar breakdowns. So 36% of the archivists and 33% of the researchers selected legal. 7% of both the archivists and the researchers picked ethics. 43% of archivists and 33% of our researchers chose access. And finally, 14% of archivists and 20% of researchers selected preservation as their main challenge with historical hospital records. So for both of these stakeholder groups, access and legal challenges were the biggest hurdles. But as one archivist noted, all of these LEAP areas are deeply interconnected. And for example, archivists seeking to conduct preservation work at hospitals are limited by access restrictions. And the ever-shifting legal and ethical boundaries determine what is accessible and by whom. Meanwhile, researchers only can consider the ethics of how to use these records if they know what information they contain, and they may be stymied by legal and preservation issues. So the researchers specifically, they described a variety of hurdles to gain access to historical health records with varying levels of success. So one participant who was both a researcher and a descendant of an institutionalized person detailed having to go through an IRB process that wasn't relevant to their research at all and ended up this took over 6 months. Another person who was also a descendant of a former patient noted that they were only able to get access to their ancestors' records once other relatives had passed away and they became the next of kin. Another experienced only being able to view superintendent reports, and additionally had to contend with a hospital that actually sent cease and desist letters to the archives to destroy the records that they had been seeking. Finally, one described the process of going through the probate court and paying $500 to become an administrator of a deceased patient's estate. One participant who was helping to change their state laws regarding historical health records argued that rewriting the law is the only way to ensure access. So in an additional poll, we asked the researchers if accessing individually identifiable health information is critical for their research. And the responses were almost evenly split with 37% saying that this type of information was necessary for their work, 27% saying it was not, and then 36% saying that this information would enhance their research, but they could move forward without it. Those who spoke after this poll expressed frustration at being unable to access information that they thought should not be considered restricted health information, like names and grave locations of those buried in asylum cemeteries. One participant noted that in her work with descendants, they all wanted to know about their institutionalized ancestors. However, participants acknowledge that this is not always the case, and cultural and familial factors have to be considered. And also anecdotally, the further in the past that the institutionalized relative lived, the less likely it seems to have, there seems to be family disputes over how that person's health information is managed and shared. The researchers held some skepticism of how well hospital administrators and archivists understand how social science research operates, and specifically how individually identifiable health information can be utilized. Several participants emphasized the importance of this information to give biographical context to patients with the goal of destigmatizing institutionalization and humanizing the residents of these facilities. And one person noted that individuals have a right to dignity and respect, and institutionalized individuals cannot have dignity if they are only known by outdated labels of illness.
So, as I mentioned earlier, and I'll put links to these in the chat as well, because you can't click it. But as I mentioned earlier, we struggled to garner enough interest from the former patient population to actually host a Zoom meeting. And our first hospital administrator meeting had a good amount of people register, but the attendance drop-off was pretty steep. So we only had actually about 5 people attend, even though we had, I can't remember anymore, at least 30 folks register. So we didn't really have enough people representative to really get a good sense of the stakeholder perspective. So for hospital administrators, so we've revamped our outreach strategy. So for hospital administrators, we've been sending around this survey, which I'm putting in the chat just in case you know anyone who might be interested in taking it out, taking the survey and giving their perspective. And we've been getting some decent response for that. I think it's a lot easier for folks who are, this is their livelihood and these issues can be sensitive, feel more comfortable filling out an anonymous survey than speaking in a Zoom room with their face in front of everybody. So for former patients, like I said, I'm working with a local peer support specialist, Rachel Alblinger in Austin, Texas. And so we're doing some local outreach, and she's helping me conduct one-on-one interviews with folks. And we're trying to connect with housing communities and peer serving organizations to conduct some direct outreach, get our faces out there, talk to people in person, one-on-one. The progress is slow because you have to build trust and introduce folks to a subject that maybe they hadn't previously considered before. But it is moving forward, and I have a lot of excitement about the potential inclusion of these folks in this conversation. I think it will add a really, really fascinating dimension to it. I'll put that survey in the chat, but it's really only geared towards people in Austin, Texas. So if you know anyone in Austin, Texas, who's a former patient of any state hospital who wants to talk with me, go ahead and send it to them. But again, we are looking like hyper locally just so we can meet them in person. And then finally, we are trying to reach descendants directly. So Lori mentioned a lot of folks are also a descendant. I'm a descendant. It's not a super uncommon thing to be, but we're trying to find folks who are a descendant without maybe an intersecting stakeholder identity as well. So not also a historian, not also an archivist, because that perspective without having the professional identity associated as well might have a different, come up with different ideas that we haven't considered. So we're doing some outreach for that. So we mentioned the symposium. We're deep. Lori and I are deep in planning this symposium, which is taking place in Austin, Texas, on September 24th and 25th. We are inviting speakers from each stakeholder group. And so we're finalizing the agenda, and in between, in between talks from a hospital administrator or from archivist or from a historian, we will have community building activities and collaborative problem solving on the challenges of historical mental health records. And then we'll also have collaborative planning for what comes next, because right now this project ends at the symposium. So it's really up in the air as to what we can do after this. But really, this event is meant to be highly collaborative and not just a space where you sit back and you listen, but we're trying to build something together. So it's a free event. It includes breakfast and lunch for both days, and the Hogg Foundation and the grant allows us to offer travel assistance for those who need it as well. So registration for this is opening in a little less than 2 weeks. And it's going to be a really unique opportunity for all the stakeholders to meet and work together in person. And I don't know of anything else like it. So it's a bit of an experiment, but I'm super excited about it. So Rusty mentioned these virtual presentations earlier. We are hosting a monthly series of these in order to maintain the momentum of the virtual meetings from last year and to continue to foster engagement in the community while we're planning the symposium. These virtual presentations highlight the work of state hospital preservation throughout the country. So the first presentation was by Alex Green and Kate Benson on Massachusetts Special Commission on State Institutions, which recently influenced a change in law in Massachusetts, opening up historical mental health records to the public. It was really great. They're fantastic people. It is on YouTube. So if you go to the Hogg Foundation's website and go to the Dialogues on Mental Health Records page, you can find a link to it on YouTube if you're interested in watching it. And then we just had one on Tuesday, and it was by folks behind the Lost Alaskans project. It was really great. And they are looking to find a way to keep their project going as they move into retirement. And so it was also a nice opportunity for folks to ask for help and ideas for what to do next. And then we have a presentation for April scheduled on the Psychiatric Survivors Archives of Toronto, which should be very interesting. So by the end of this project, I hope that we will have built a little community who is passionate about mental health history. We will have published reports synthesizing and making sense of all of our discussions. And maybe we will have developed some strategies that are effective and comprehensive because they will have been created jointly by experts across all of these disciplines and life experiences. So that's what we've got for you. Here's our contact information. Feel free to email us if you think of something later or want to chat. And I'll put my email in the chat as well. I'm going to stop sharing.
Thank you, Elizabeth. Thank you, Lori.